Welcome back. It's time to check in with our friends from MUSC Columbia. Today's topic is hospice and home health care. Joining us first is Justin Franke. Thanks for being here.
Thanks for having me.
So tell us who all is eligible for home health care.
Home health is a service that's offered to people who can't reasonably get out of the home. They have a difficult, taxing effort. This could be somebody that's just had a surgery or has been in the hospital for a few days and they just have gotten weak and they're just not able to safely get out and go to the doctor's office. It can also be for somebody who's just had a decline in function, or the doctor has just seen them and said, hey, you're not safe to get out and come to the doctor's office. Let's send a nurse, let's send a therapist out to take care of you in the home.
Now, what does that referral process look like?
The referrals can come from a doctor, a medical doctor, a physician's assistant, or a nurse practitioner, and they send a referral to the home health agency, and then we get out there and see the patients. It can also come from a hospital if they've just come from the hospital.
Okay, so what types of services do you offer? I understand there's a big range from, maybe emotional services to more physical therapy services.
Yes. We have a nurse, skilled nursing care, that can come out and they do medication checks and they teach about disease processes and really trying to keep the patients out of the hospitals and getting them back to a functional level where they can take care of themselves medication-wise. We have therapies, we have physical, occupational, and speech therapies in home health, and they come to the home and do all the same things that they would do in an outpatient clinic or in the hospital. They're in the home to get the patients functional again so they are independent. And then, like you said, we have a social worker who is there for more of emotional, taking care of community resources, trying to help them figure out how they can get the things that they need to get there in the home, and then for long-term care planning too. We also offer certified nursing assistants to help with the bathing type of stuff when they first get out of the hospital or if they're weak, to try to get them back to a level where they can take care of that themselves.
I know these services are so important. Is home health care typically covered by insurance? How does that work?
Yes, it is.
Wow.
It's most major insurances cover home health. It's a service that patients are really looking to use when they need that.
What is the process like of creating a plan for each individual? Because everybody's different, they're going to need different things. So what does that look like?
It starts from the referral because the doctors usually have something specific that they've seen when they're in the clinic or in the hospital, and they want us to focus on that. And we'll go in. The first visit is a thorough assessment. Either a nurse or a therapist is going to go out and check out everything in the home. They check the medications. They're going to check the home for safety. They're going to check the patient themselves and see what those limitations are and what they need to be addressing when they come into the home. And then we'll come up with a very detailed, specific plan for that particular patient and include their goals, what they want to get out of it too.
And how about getting their family involved in that?
Absolutely. That's very essential to all of home health. We find out who the caregiver is, the main caregiver. If there's nobody in the home, we'll communicate with friends, family, kids that are outside of the home that we just need to get involved. We really need the family and the friends to be involved.
Thanks so much for that helpful information.
Absolutely.
Joining us now is Rebecca Watkins to tell us about hospice care. Thanks for being with us.
Yes, absolutely.
So tell us about the hospice care program.
So our hospice care program, I personally think, is one of the best, of course, in the world. We have a very compassionate team. On the team, we have several disciplines to include the medical director, the nurse, the medical social worker, the chaplain, and the CNA. We also have volunteers that help, which is, of course, tremendous help for the families and us as well. And then, if needed, we can send therapies out to the home as well to help.
Now, who is eligible for hospice care?
So you have to have a terminal diagnosis, but there are many people that are walking around every day with a terminal diagnosis, whether it be cancer or Alzheimer's or something like that. But these people have decided that they no longer want the treatment. So if it's a cancer diagnosis and they have decided that there is no more chemo and radiation is not working anymore, so they decide to turn to hospice. So those patients would be eligible. Those patients in kidney failure that no longer want to receive dialysis and they're just ready to spend whatever time they have left, for the best quality. Those would be those patients that would meet hospice criteria. We'd have to, of course, contact the physician for an order, and then we would go out and consult with that family and patient and really just talk about what hospice is and make sure that would be something that they're interested in and try to provide those services for them.
How do you handle this super sensitive topic, especially, for caregivers? It's a really hard decision sometimes.
So it is, and we just really try to meet them where they are. For some families, that means we can be very open about death and dying, and we can talk about that right away. Some families aren't ready to face that yet, and so we do have to just at each visit, we just kind of assess where they are with that, and if they're ready to open up and talk about those things, we can. But of course, too, we have our whole team, so it's not just the nurse that's going in there every single week. The whole team is going, so it's not just the nurse that's talking about death and dying too. It's the social worker and the chaplain that are all going in there and trying to talk about those sensitive things with the patient and the family. Sometimes those things need to be talked about away from the patient or away from the family, and it's really important to you just to include the patient in that. Sometimes we forget about, and we want to be selfish and think about our needs and wants because we don't want them to die. So it's really important to ask that patient, what is important to you, you know, and what do you want to get out of hospice, and what are your thoughts on death and dying? So,
is there anything that's really special that's planned for those who do get to see another birthday?
Yes, there is. And we actually have patients that are on a longer length of stay as well, but for those who do get to see another birthday, that is very special. And we do have one of our volunteers that takes them either a cupcake or a piece of cake and a balloon and a visit. So they do. It's very special.
Now, I know this is a really hard time for many people, the transition into hospice care, and then, you know, if a family member is in hospice care, that's also very tough, just living with that. What kind of support do you have for family members?
So we have our social worker that goes out normally monthly, but can do bi-monthly as well. I think the social worker and the chaplain are huge support for the families, because the nurses and the CNAs are going very frequently, right, every week. The social worker and chaplain go a little less infrequently, but they're a huge support for that family. The volunteers can come in and sit in the home with the families while they go out for groceries, pick up medications, whatever. But we also can do respite, or it's called GIP, which is higher level of care for those patients that maybe we can't get the symptoms managed in the home. We've tried all the meds that we have and all the magic that we have, and we just can't get them to a level where they're comfortable. So we talk about inpatient care, and that's a higher level of care, and it is in one of our contracted facilities. And then respite care, like I said, normally that's for caregiver breakdown, and that is with a contracted facility as well. They can stay for 5 nights and give that caregiver a break as well.
Thank you so much for being here.
Thank you for having us. Thank you.
We'll be right back on Soda City Living.